Welcome to Spectrum Health TV. I'm joined by Dr. Bob Connors, a surgeon and president of Helen DeVos Children's Hospital. Welcome, Dr. Connors.
Thanks, Carrie. It's a pleasure to be here.
First question I have for you is, what is the difference between a children's hospital and an adult hospital?
The first thing is that there aren't very many children's hospitals, and I think people in communities where there is a children's hospital take them for granted. But they're really quite special sorts of places, and mostly because of the people that are in them. They're filled with people with special training and exceptional skills, but also folks that really like working with kids and families. The feeling of a children's hospital is different as well, and I always liken it to the difference between a kindergarten and a high school. They're both for education, but there's no mistaking which one's for little kids. Kids have different needs, and we have to respond to those. So they're also filled with people that you might never see in an adult hospital, like child life specialists, who are there to relieve the anxiety of kids, to use play therapy, and get them through what, for almost everybody, is a pretty stressful time.
And so what is the mission of a children's hospital?
Well, first and foremost, we want to make sure that we're giving the very best care to children and their families when they're in need. And the need is great when you have a child in the hospital now. Most of those kids are very ill, so we're responding to the most serious illnesses with critical care capabilities, and we want to make sure that we're offering that kind of support to all the kids.
And then what about research and advocacy? Does that play into your mission?
Bringing the latest things in research is very important, especially bringing it from the laboratory into the hospital, and that's a place that we really want to be working. Training the new physicians for the next generation is also very important, and we take that job very seriously as well. And the kids in the political area don't seem to have much of a voice, so part of our job too is to make sure that things that are important for children's health are being advocated for, that people are hearing about it.
I know there's more than 40 pediatric specialties at Helen DeVos Children's Hospital. Can you talk a little bit about that?
Yeah, I'm proud to talk about that. Actually, we have very fine specialties, and it's unusual to have that many pediatric specialists around. It really takes care of everything from the most difficult medical diseases to the most difficult surgical diseases, from babies as tiny as 1 pound to big teenagers. And I think some of our premier programs really are our capabilities in critical care, in injuries. We have a very fine cancer program. We have a lot of surgical specialists, which is unusual for a typical hospital, would not have that. Very, very fine diabetes program. And you kind of go down the list. So you can see a typical hospital might not have any of those people. And what's important for our community is to know that we have all those people, anything their child's going to need.
And I think it's important for parents to know that these people are specifically trained in caring for kids.
Yeah, exactly. And that's, most of us have to do extra training for that so that we're comfortable in giving the best care for kids.
I think that's very comforting. Finally, I want to ask you, I know in 2011 there's going to be a new Helen DeVos Children's Hospital. Can you tell me about that facility?
Yeah, Carrie, we're really excited about it. Obviously, when we started to think about the opportunity to have a wonderful new facility, we really went back and made sure that we were addressing what that facility was supposed to do for us. And what we think it's going to do for us is allow us to care for children and families better. There are a lot of innovative things in the hospital that allow the caregivers to be close to the patients, in the rooms. The rooms are going to be wonderful, lots of space for families to be with their kids. Other innovative areas, we're real serious about keeping kids comfortable in the hospital, and we have a wonderful sedation program and just the right setup for that, where now it's not that way. And I think that people will notice a lot of new things: an emergency department just for kids, operating rooms for children, their own radiology department, their own cardiac catheterization labs. So special places for what I think are very special people.
Well, I appreciate you sharing this information with us, Dr. Connors.
Thanks, it's been my pleasure.
And I thank you for joining us for this edition of Spectrum Health TV.